And we have Dr. Joe Wietfeldt with the Center for Plastic Surgery in the studio this morning. Thank you for being here.
Glad to be here.
Yes. Now we're talking about a very interesting topic, mommy makeovers.
Yeah.
Is this a common thing that we're seeing here starting to happen?
Yeah, I mean, it's a term that's kind of described to identify areas of a female body that changes after having a pregnancy and delivering.
Yeah.
The two main areas would be the breast area and the abdominal area. And those changes happen just from natural changes from having a baby. So we see changes of loss of volume or drooping or sagging to the breast area, or extra fullness or sagging or loose skin to the abdominal area that needs to be addressed.
Yeah, so what do you guys offer, those new moms who just want to get their old bodies back?
Yeah. Well, obviously it takes a while for the changes to kind of finalize, so we know what we need to do to correct those areas, but it may be either adding volume to the breast area with an augmentation, or just tightening the skin and repositioning things of the breast area to kind of lift things to that area. And then sometimes in the abdominal area we'll notice extra fullness or loose skin, especially after maybe having a C-section to that lower abdominal area.
And I'm sure with procedures and surgeries like this, you have to have like multiple consultations with doctors, right?
Usually one consultation will kind of get the right idea of what we need to do to correct, and then it's really just going through the risks and benefits of the procedure and kind of getting things timed and planned to get it done for you.
Now, what are new moms or moms you've worked with, what are they really wanting to get done?
Well, they just kind of want to get back to their old self.
Yeah.
I mean, obviously you have a nice bundle of joy after having a baby, but it does give some changes to the woman's body, and sometimes they're not as self-conscious, or they're more self-conscious about that, and they just kind of want to get back to where they were.
Yeah, and then a big thing is cost for surgeries like this. How do you all go about that? Is it through their health insurance, or how do they pay for things like this?
Yeah, most of these surgeries unfortunately are not a medical necessity or functional deficit, and so it is considered a cosmetic procedure. Sometimes we'll combine surgeries, the breast surgery and the abdominal surgery. So there are discounts with doing more or multiple surgeries at the same time. So you have to talk to your doctor about kind of what can be done together.
And then what's the recovery process like? I'm very interested in this topic.
Yeah, probably the biggest thing is a weight lifting restriction, just because we don't want to stress or overdo things that have been corrected. But it's soreness and achiness for a week to 2 weeks, but maybe the lifting restriction for several more weeks after that typically.
Okay, and if anybody wants to contact you or get more information about this, how would they go about doing that?
Yeah, they can look at the Springfield Clinic website, or they can call the Springfield Clinic to set up a consultation.
All right, thank you, Doc, for being here. All right.